But first at 6, COVID making a comeback. The new variants we've been warned about for months are finally here and contributing to an uptick in cases across the U.S. Good evening and thank you for joining us. I'm Brian Blakely.
Good evening to you. I'm Alicia Barnes. Well, the CDC says the new variant accounts for more than 40% of cases, and that's up almost 100% from just a week ago.
Yeah, here's a look at the numbers right now. According to Mecklenburg County Public Health, there was a 73% increase in cases reported the first 2 weeks of December compared to the previous 2 weeks, and a 17% increase in emergency room visits. Well, another aspect of the pandemic that's making a comeback is mask wearing, but now it may not be entirely for COVID. Queen City News anchor Derek Dellinger live in Uptown tonight with that.
Think masking is a bad idea.
Not just COVID, but the other respiratory viruses like the flu and RSV and common colds are circulating.
Say what you will about masking, and people certainly have, but it is coming back. School districts in various parts of the country are looking or have gone back to masking up.
I'm just concerned about it because I've heard I know 3 people that already got sick and they're coughing and everything.
2023 may not have COVID front and center, but Dr. Washington believes the lessons learned from 2020, 2021, and 2022 have people taking extra precautions, especially when it comes to their health and the health of others.
I think so. I think certainly, especially on the if you're sick, stay home. I think that's one of the biggest lessons that I think everyone in our community has learned as a result of COVID is that there's always a risk of if you're not feeling well, there's a risk you have something that's infectious.
And even though case counts are going back up and we're starting to see those new variants, we should mention that any discussion of any mask mandates, that has not really been part of anything that we've seen, at least here locally, at least so far. We should mention, though, that some businesses do reserve the right to require masks if they have to. Hospitals are doing that for obvious reasons, but some businesses are also requiring that, too, because they can. Live at Uptown, Derek Dellinger, Queen City News.
Derek, thank you for your coverage on that. I want to give you a little bit more context here. Public health officials have new concerns over one coronavirus variant in particular and whether vaccines used against the virus are actually spreading it more. A Wall Street Journal report says an Omicron variant is changing so much, so fast, that immune imprinting from vaccines may be adding to its mutations. Now, the experts say the mutations let it evade antibodies from prior infections, and vaccine boosters may not prevent other Omicron variants. However, experts also caution that boosters still provide improved protection, even if only slightly increased.